like my patient fell, for instance. I look, make sure I only have one patient. I consider ALS. ALS has been dispatched. I want to take C-spine precautions. I'm going to take C-spine precautions right away. I'm going to ask my partner to please take over C-spine. Who's my partner?
Well.
Okay, I can't let go until you bring your arms around. Okay, make sure you hold C-spine correctly, please. Do not move his head and or neck. Okay, I'm going to look for any, I'm going to get a general impression of my patient. He's laying here. Seems to be unconscious. I'm going to look for any life-threatening injuries. I'm also going to go ahead and open up his airway. Okay. I'm going to make sure there's nothing blocking his airway at all. Making sure that he's breathing. Because of the fact that he is unconscious, no gag reflex, I'm going to go ahead and put in an LPA to protect his airway. I'm going to start ventilating with a big valve mask. What I would have my partner do is go ahead and ventilate the patient. How can he do that with holding C-spine? He would bring his knees up. You don't have to do it, but I just want to explain. Bring his head up between his knees. That way he's holding C-spine that way, and he's able to ventilate my patient now.
Okay.
Making sure that his patient is being adequately ventilated. I'm going to go ahead and attach the BVM to 15 liters per minute so my patient gets 100% oxygen. I'm going to go ahead and check the circulation. I'm going to do a quick overview of, please don't let go of C-spine.
Don't let go.
Okay. Quick overview of my patient, see if there's any major bleeding. Proctor would at this time tell you if there's any major bleeding. Proctor says there's bleeding from the right forehead. I'm going to go ahead and apply direct pressure. They'll say, okay, bleeding is controlled. I'm going to check my patient's pulse. At the same time, I'm checking the skin for color, temperature, and condition. Okay? And then also, now I'm going to determine the priority of my patient. My patient is a priority 1, so I would want to load and go. So that means I want to go ahead and do a rapid assessment. Should only take me no more than 90 seconds to do this head-to-toe assessment. Okay? So I'm going to go ahead and palpate the head, looking for any deformities, any bleeding, any decap, VTLS at all. I don't find anything. The bleeding on the forehead was already controlled. Okay, I'm going to go ahead and I'm going to open up my patient's eyes and I'm going to check the pupils for reactivity. I'm also going to go ahead and look for raccoon's eyes. I'm going to look behind my patient's ears. Make sure there's no battle signs. Look for any blood and or CSF coming out of the ears. Check the nose for any singed nasal hairs. Make sure there's no blood and or CSF coming out. I'm also going to check bone integrity of the face. Make sure that there's no deformities there at all. I already checked the mouth. The mouth is clear. I'm going to go ahead and palpate the back of my patient's neck. Looking for any tenderness, any deformity. Also going to pull out my hand, making sure there's no blood coming back on my hand. I'm going to go ahead and make sure that the trachea is midline, which it is. Make sure there's no JVD. Okay. At this time, I'm going to go ahead and measure my patient for a C-collar. I'm going to measure from the lower jaw to the clavicle. Go ahead and I'm going to grab my C-collar, measure. Got it ready. I'm going to go ahead and please don't lift up on the patient's head at all. Slowly slide the C-collar underneath. Around onto my patient. Okay. Now what I'm going to go ahead and do, because I want to visually inspect. Yeah, don't let go. Go ahead and inspect. In order to inspect, I have to cut my patient's clothes off. Okay. I'm also going to auscultate for lung sounds, bilateral lung sounds. Make sure I have those. Okay, I'm going to palpate each of the clavicles. I'm going to palpate the chest. Again, looking for any decap, VTLS, any open injuries at all. I don't see anything. Come down to his abdomen. Palpate each quadrant. Looking for any distension, rebound tenderness, any other possible injuries. Go ahead and check the pelvis. I'm going to push down, push in. Looking for for bone integrity, any deformity. I don't see anything. Need be, per the scenario, I might have to check the genitalia area. Okay, going to go ahead and down to his lower extremities, palpate his legs, looking for any decap BTLS, get to the bottom of the leg, check for a pedal pulse. Okay, patient's unconscious, but I'm going to pinch the top of his foot. Sir, if you can feel this, wiggle your toes. Okay, go ahead and go to the other leg, palpate, again looking for any decap BTLS. Mm-hmm. Yes, I'm just doing it slow because I'm showing you guys. Okay, again, checking for a pedal pulse, and again, pinch the top of his foot. Sir, if you can feel this, wiggle your toes. Okay, go ahead and go up here to the upper extremities. Again, checking for decap BTLS. And out, along the way, if I see any life-threatening injuries, I would address it. Check his pulse. Wiggle your fingers if you can feel me pinching you, sir. He's not doing anything. And then also, with unconscious patients, you also want to look at their face, because sometimes they'll make facial expression when you pinch them. Okay. Check for decap BTLS. This arm, check for his pulse. Pinch him, see if there's any reaction at all. There is none. Okay. So now what I want to do is I want to log roll my patient. The person at the head holding C-spine is in control of the count. I want to roll my patient towards me. I also want to make sure I don't roll my patient onto any injuries. There's no injuries on this side, so we can roll him towards us. So what I'm going to do, I'm going to bring his arm around. I'm going to put one hand here, one hand here, and at your count, and you're just stabilizing the head.
1, 2, 3.
Okay. Now again, I'm going to go ahead and palpate the spine. Palpate the back. Again, looking for any open injuries, exit wounds, any decap BTLS. Okay. Blood in his pocket. I would check the buttocks area. Maybe he got shot there. What did he do to get shot there? Palpate the back of the legs.
You can give it up.
That's not a bullet hole.
Okay, so I don't see any further injuries. Now, what I want to do is we want to get him centered on the backboard. So we're going to tilt him just a little bit more this way. Put him at kind of an angle. Going to bring this backboard up. Going to bring the backboard, tuck it in as much as we possibly can. Put the backboard at an angle. Has to go up a little bit higher because of where his head is. Okay, now, at your count, we're going to log roll him over.
2, 3.
Okay, now you know he's not straight on this board, right? So how do we get him straight? We don't push him over. Okay, because what are we doing to his spine? Moving him around. So again, with the person at the head in control of the count, we're going to move him down and up as much as we have to until he's centered on that board. Okay? So, I'm going to ask for some assistance in moving him because he's not doing any lifting. I am. So, I need an assistant. Okay, don't move the legs over, just you move them as a unit. Yeah.
1, 2, 3.
Okay, now we're going to go down. Actually, you're supposed to be in charge of this,
2,
not me.
3.
Okay, you have to tell us whether we're going up or down.
Come on. 1, 2, 3. All right, he on there.
Okay, yeah. And you slightly lifted his head on that, so make sure you don't do that during testing. Okay, now you still got to hold on. So now we want to strap the patient in. Strap the patient to the board. There it is. Okay. Make sure you don't put any straps over any injuries and not over the knees. Okay, let's say this leg was fractured, then you would just go underneath with it and then back over this leg. under the board again. Somebody lift the board slightly without tipping him off. No, he's laying on it, I think.
No, it's right there.
No, that's the one that's strapped all the way under because of the type of the strap it is. Yeah, it is.
I'll bring the strap.
It's under his, I'm putting my hand where I shouldn't be putting my hand.
It's medical, you don't worry about that.
There's, okay, where's the other side? There we go. And you should put padding ideally there if you're gonna be putting a strap over that particular area for obvious reasons. Head always gets strapped last. Straps are caught up under the board. Guys, help me with these straps.
Just lift up and pull.
I would also, my partner who's holding T-spine, if my partner was conscious, would be asking for a sample history. If the
Yeah, you signed
patient's
the sample.
unconscious,
Any allergies?
if the patient's unconscious, you can ask
Medications?
bystanders possible sample history.
Any pertinent medical history?
Also direct my partner to take a full set of vital signs, goes this way.
Well, then it's
So they go
crisscross.
crisscross. If the patient's unconscious or has had a stroke, you would want to strap their arms in.
Not the blocks, right?
Now we need the head blocks.
Blocks. You gotta do it, Jessie. Okay, I got this table. Two, I got this table. Now you gotta tape it down, right?
We're not using tape. Where's the? We're using these regular straps here. Okay, you can put that one on. Oh, no. Keep holding it tight. Not on top. Proper way.
I don't wanna squash it.
You're not squashing them.
Okay, she said I ain't squashing it.
Okay, you take that end, I'll take this end. When you're putting this one across the chin, make sure it's on this part of the C-collar, not over the opening of the C-collar. Pull them as tight as you possibly can,
How you secure it? Just in the Velcro or in the loop?
in the loop and then Velcro.
Okay.
Make sure that's pulled tight. I know he's probably uncomfortable, but I'm gonna ask him
Would I
a
have a,
question in a second.
Put it inside.
Yeah, can you move your head?
That'd be nice.
Shake his head.
I see.
Okay, then after you have him totally immobilized on the backboard, you want to check PMS again in all four extremities. Okay, on the way to the hospital, what I'm going to do is I'm going to assess for any secondary injuries. I'm going to reassess his vital signs. If there was time, then if there wasn't any life-threatening injuries, then I can address any secondary injuries. And obviously, those legs should be together, and that strap down there should be tight. Any questions?
Yes. I have a question. How do you retrieve the back inwards if in fact he's having